My health conditions are not really good. I have sugar diabetes, and I have lost my left leg, and I've lost my right part of my right foot. I have a bad heart. I've had 2 heart attacks, and so I have several different health problems. And right now I'm just waiting for my foot to heal till I probably get therapy in here to help me learn to walk again. So that's what I'm waiting on as far as that goes. The aides come in and they'll help me with my bath, and they'll do my laundry, clean my house, do cooking if I want them, if I want something special and I can't do it, they'll do it for me. And they just do a lot of things for me. They dust and they clean, and keep things picked up till I can walk, or till I can get through the house with my wheelchair. And so that's basically what they do, and then take care of me if I need anything, if I need any errands run, or my medicine picked up or whatever. Yeah, they do all of that kind of thing for me. I'm a homebody. I just like being at home, and I don't know. I guess I think I can't survive if I'm not at home, and I feel more comfortable, which I think everybody does when they're in their own environment, and that's why I wanted to be home. But I knew I had to have help when I got here. They help me with transportation. They transport me to the doctors and hospitals and wherever, and then I have an emergency button that I push if I need help. And then they built my ramp so that I can get in and out of the apartment in a wheelchair when they come after me for the doctor or something. So they have done all that stuff for me too. And then I have home delivered meals, and so they do a lot. I feel more freely. I can eat when I want, sleep when I want, do what I want. I wouldn't want to see anybody go to the nursing home. I would want to be at home, and I think they should be at home. And I was in the nursing home. I saw a lot of people that if they just had a little bit of help, they could be at home. And I think I think they should get the help, and they should be at home and try to live as independently as they can. And a little help is always nice. It wouldn't be as many people in the nursing home, because a lot of them is in there and they need to go home, and it's like their home life is they want to be there just like I did. So I know where they would be coming from, and I think that's the main thing. They want to go home, and I think they should be there. I think they should be allowed, and they should have the help to do that.
Waiting for months would have put Helen in jeopardy of being evicted. She spent down her entire life savings over 4 years at an assisted living facility, and we would have had to transfer her and look for nursing homes, and that's not what we wanted to do. Helen has mixed dementia, a weakening of the left side of her body caused by a stroke, and she's legally blind.
We definitely don't want Helen in a nursing home. Per her physician, she has a relatively healthy condition right now. She is only on a couple of meds a day, and she needs custodial and residential care rather than skilled medical care.
Throughout Helen's whole life, she was very adamant about not being what she would refer to as put into a nursing home. And under the waiver program, the assisted living waiver, she is able to live in her own apartment, which is decorated with her own possessions from the house that she used to live in. And also we, as her family, can visit her as often as we like. By doing the assisted living facility, Helen's dollar was stretched, her dignity was preserved, and we were able to honor her wishes, which was very important to us. We were very concerned about something that we had heard referred to as transfer trauma. We did not want Helen to be in unfamiliar surroundings, because we thought it would confuse and possibly upset her. Nursing homes were more expensive than the assisted living facilities, and if she would have had to pay for the nursing home costs, it would have eaten up her money much sooner. Nursing homes were also more restrictive in what they allowed Helen to do on a daily basis, and they had a much more institutional setting, and we were not happy with that. We definitely wanted her to stay in her own apartment. I would say that it's very important to keep our senior citizens in their own homes, their own apartments, or assisted living facilities, so they can be within their familiar surroundings. They can be comfortable, and they can be taken care of at a level that is most cost effective to them.
Yeah, I have had prostate trouble. I guess it's cancer, but I seem to be getting along pretty good. I took some kind of treatment, radiation treatment for the cancer. And I think I had 18 treatments. And so that may have helped. At least I don't seem to be troubled that much anymore. So I'm getting along pretty good now.
I had a touch of arthritis on my right side, my shoulders, my elbows, my hands, and legs, and I need a cane to walk, but arthritis doesn't pain me any, but it's kind of a nuisance.
Well, I was in the hospital first, and when I got better, well, they recommended me to go to the nursing home. And I was there for a while, and for some reason they sent me back to the hospital. I forget just why that was, and then I went back to the nursing home again. But I know I didn't care too much for being in a nursing home because the time passed so slowly. You know, you were in bed most of the time, and once in a while I'd get up and sit up in a chair. But I was really happy to get out of the nursing home. I know that. But the people waited on. I don't have any complaints about the nurses or anybody. It was just that it was boring, that's all.
Yeah, I was feeling pretty good, except when Bob went to the nursing home. I missed him quite a bit. I've been here 62 years, and there's a lot of advantages of being here. My friends can come and see me, and once in a while they take me out in the car. I don't get out very often, but sometimes they take me to the doctor, and I enjoy being here quite a bit. When I die, I hope it's here.
Well, I am concerned about being on the waiting list, but I don't think there's anything you can do about it that I know of. Yeah, what I want to tell people is that I don't like being on the waiting list. I'd like help immediately or whenever. If I need it right away, why, I want it right away. So that's about it.
Well, my mom has had some serious falls. In May, she was in the hospital from a fall, and at that time, they diagnosed her with Alzheimer's dementia. My dad we thought he had a stroke 6 months ago. Not 6 months, 6 years ago. But his doctors also diagnosed him with Alzheimer's dementia. And his is short-term memory loss. I mean, he can tell you anything you want to know from a long time ago, but not much now. My mom is in the early stages. So I started thinking, well, we are going to need some help. Difficult. Some days are better than others. But they're not to the point that they would need a nursing home, and we wanted to keep them in their own home and together as long as possible. They have a helper that comes in every day, and after she's come in a couple times this week, we decided to increase her hours of the morning and of the evening. And then they also have the emergency response button. The lady came yesterday and set that up and was very helpful in explaining everything to Mom and Dad. And then they also have Meals on Wheels that comes in the middle of the day with a hot meal and also bring an evening meal. And then we have a nurse because my mom takes insulin, and the helper during the day is not permitted to give them their medicine. And we have to have a nurse to give the shot. It's important for Mom and Dad to stay here because they're a big part of our family. And Mom and Dad have been working people all their life, and having a home that's theirs means so much to them, And, they grew up living that American dream, and now, their fear is being separated, being taken out of here, and being in a strange place with strange people. But we were very concerned because Mom has trouble walking, and she's had some severe falls. And Dad, if she had to go in the hospital, Dad couldn't remember where she was. It's necessary that we have some help in here, and the help that has all of a sudden come about in the last 2 or 3 days has been very important. And I can see, down the road, they may have to do assisted living or something, but as long as they can stay here with the help, that's our intent, to try to keep them here where they're happy and everything's familiar to them. Because with the Alzheimer's dementia, that's a very important thing, I think, is keeping things familiar. But this whole process has been, long in coming. It gets discouraging sometimes, and there has been thoughts of maybe a nursing home, simply because if Mom fell and broke her hip, Dad couldn't remember she's in the hospital. When we started the process, Central Ohio Agency for Aging Adults were very, very helpful. They walked me through every step of the way. And even the social worker helped me explain what I needed to do, and when I didn't have everything, they told me how to get it. And that was good, but then it's discouraging when they say, you call and you say, well, where are we with the process? We jumped through all the hoops that we needed to jump through. Now where are we? You kind of get that feeling that, okay, you've done all the paperwork, so now the services are coming. And that's just not the way it is, because once we started the process, they had a 50% cut. The government cut the funding. You get to thinking, well, what can we do? Well, you could immediately, just practically immediately, the doctor could write an order and they could go into a nursing home. Well, that's not what my Mom and Dad wants, and that's not what we want. My Mom and Dad are too active to be in a nursing home. Mom may move slow, but she's still moving. She may have Alzheimer's, but her brain is still working, and she enjoys life, and she enjoys being in her own home. And it's just awful to think that that path to a nursing home is so much easier than a path to bring someone in to help out, to help the family a little bit and the caregivers. And also, I would think it would be much more expensive for the government to try to keep someone in a nursing home when they could assist them in their own home and then be able to stay in their own home. With the passport system and the emergency response, it relieves my mind the hours that I'm not here. because we couldn't be here 24 hours. And I don't think at this stage in their life that mom and dad need 24-hour
No, we
care.
don't.
You know,
Because he's right here with me always and ready to do anything that needs to be done.
my mom and dad have worked all their life. They've paid taxes all their life. And they've never really asked for help from anyone or any government agency, have you, Mom, all your life. And now, though, they need help. We need help helping them. I mean, they possibly can live right here their entire lives. And why wouldn't you pay less for more? And that's really what they're doing. They're paying less and giving the elderly more of a chance to stay in their own home where they're comfortable. I'm really sad that people that are on the wait list, I mean, we've moved up that list. It's been a long time coming, but something could have happened and my mom and dad would not have gotten services in time. And I feel really sad that people on that wait list, if they had a fall or an injury or something happened to where they couldn't live in their own home, their only alternative is a nursing home. And that's just not acceptable. I think that's just not an acceptable thing for our elderly people. We need to respect the older people and we need to help in any way that we can.
Living at home is important to me because I just like my home. And it's what I wanted. I made this home from scratch. And we love living here. We're happy. It's just what we needed. I don't think I'd like a nursing home at all because you're alone so much. And I'm one that likes company and likes my husband, and we spend a lot of time together. So I would rather live at home as anywhere.